Good morning, everybody. Yeah, or is it afternoon? Yes, almost afternoon. So I've been tasked to discuss on an aspect of male infertility that men too contribute to infertility. Next slide. Okay, now, I think we are all familiar with the fact that at present, the prevalent culture is the placement of the burden of infertility on the woman. When a couple comes to the clinic, they generally say, the man says, introduces the woman and says, I've brought her so that you can help her get pregnant. The male is infallible. The male is not supposed to be culturally infertile. And that is still prevalent even today, even in private practice. We get an element of that. That is when men come. And when they do not come, then they refuse to get investigated. And they have to go through a lot of persuasion. This is a cultural misdirection of blame that presumes that men can never be infertile. So they're indelible, always fertile. Now, this observation makes it necessary for us to use all available channels to effect a cultural shift, and that the media is, of course, pivotal in this strategy because the media has very high level of penetrance into the community. Now, this negative effects of selective bias on the blame to women, all right, causes a socio-cultural stigma and has several impacts. One is that there are references with connotation and innuendos of failure, and this is the stigmatizing part of this cultural belief that men are infallible, that men will always be fertile. And this results in ostracism, that is social isolation in the community. These women live, like we have seen in the various videos, as isolated people. There's delay in search of effective services, both diagnosis, effective intervention. A recent study that we did showed that the male was one most important reason to prevent effective treatment of infertility in all socioeconomic levels in this country. Then the other aspect is instability of the marriage. Now, this serves to the woman who is ostracized as a constant reminder of failure. She feels she has failed the community, she has failed the society, she has failed the in-laws, and so on. Now, it is this that motherhood is viewed as the cradle of womanhood. And I think this is where we're talking about a shift of culture, a shift of belief, a shift of understanding. And there's a need then for cultural shift in order to view a woman more than just a woman. That's a human being, we are all human beings, and that infertility affects both man and woman. There's an accepted fact that men are core to reproduction. That's a fact, all right? You require a pair to reproduce. And the neglected fact is that men can be core to infertility problem. And I think of this data is derived from many studies in this country. And we have approximate distribution of the causes of infertility, the female alone contributes to 40%. Male alone contributes to 30%, that's 1/3. Male and female combined contribute to 30%. And then you can look at total male contribution, which is 30 plus 30% is 60%. It's a sizable proportion. And total female contribution is 70%. The bottom line is that the weight in contribution is basically the same. So what causes male infertility? Some of the causes have been mentioned by the previous speaker, but we're going to go through this. We have anatomical, physiological, environmental, and dietary factors. The anatomical, which are physical defects, for example, can be acquired. For example, urethral obstruction is an acquired. All right? We don't want to mention castration. That can also cause that. Congenital, this is born with a defect. These are not very common in terms of congenital. And here the issue is production or delivery systems are affected. If it is infective, for example, it's like I said, that you can have anywhere from the testicular level, which is production, to the delivery system, the various tubes, the urethra, vas, and so on may be obstructed. All right? And this is an important aspect when we talk about prevention. Now, physiological is field function, for example, hormones. And environmental influences, like excessive temperatures. Somehow, testicular function requires a lower temperature than the body temperature. And this is why the pocket, which is the scrotum, is actually more external. Radiation, this is the environmental factor. Then drugs like alcohol, use of hard drugs, and industrial toxins, which have been alluded to. And then, of course, dietary factors. Anything that causes, for example, diabetes, anything that causes cardiovascular diseases will affect sperm production or delivery systems. Now, we have, this has been shown there. We have shared this with the Merck Foundation. Alcohol, avoiding drugs and smoking, and high temperatures. These are some of the sources. I think people are now riding in Kenya borders. This is commercial motorcycles, very hot baths. All right? And then the other side is adequate exercise and avoiding, of course, exposure to industrial toxins, which have been alluded to. Some health tips. One is obesity, is directly related to testosterone levels. All right? Obesity is an important cause of infertility. Of course, a balanced diet provides the necessary nutrients. This is the corollary of what we said earlier on. Take-home messages. One, we need to effect a cultural shift through destigmatizing infertility, so that we do not isolate people with infertility. We see it as an illness that needs correction, that we do the best that we can to help those who are infertile. Number two, increase awareness that infertility affects men and women equally. And this is where the media comes in, because that's the best way of providing this. And of course, for good media reporting, knowledge is key, that we get educated on the causes of infertility. All right? So that, I want to say that on the debate of yesterday, that really when I was leading the task force on regulatory framework, we had many people that we interviewed, including religious leaders. Actually, in Kenya, apart from one sect, all the rest embrace infertility. They say there's no problem. And those who don't want let them stay because it's a choice. But I think we need to actively spread the message of infertility, and particularly that men should be involved and that they are active contributors to infertility. We need to make the community understand that all aspects of fertility is a shared responsibility. Understand that fertility is as a result of interaction of man and woman, and infertility requires to deal with the same couple, a man and a woman, if we are to deal with it effectively. Then there's a need to understand there is more to a man or a woman than being a father or a mother. You are not born simply to reproduce, but to be in a community. And I think within the community, there is much more that you can do to the community. And your status can still remain visible and important in the community. Then we all need to have a concerted effort to break the stigma around infertility in order to create a cultural shift through demystifying infertility. This means knowledge, disseminating knowledge, and this is why we're talking about the media. We disseminate knowledge. All right, knowledge to the community. Knowledge allows communication, effective communication. And if we can communicate about it, we are going to demystify it. Thank you very much.